Hurricane Harvey impact study are out, but researchers need more residents to participate. It found 46% of respondents had to leave their homes because of flooding. They were displaced on average for 20 weeks. Most stayed with family and friends. The data is being collected to study long-term effects and prepare for future disasters.
So there are a lot of things that we need to know. The information is critically important, and that's why we want to stress, please, if you haven't already provided information, harveyregistry.rice.edu.
Once again, you can join the registry by going to harveyregistry.rice.edu. Over 13,000 people have given input.
We're getting another look at the impact that Hurricane Harvey had on families. Houston Mayor Sylvester Turner and community partners are releasing that information today. People affected by the storm filled out the Harvey Hurricane Registry, and it is a research study that collects information about where people lived during that time, how many were in the household, people's experiences, loss of money, other factors. Mayor Turner says the impact of Harvey not only took a toll physically, but mentally.
Of those who had to leave their homes because of flood damage, 68% or more said, I thought about it when I didn't mean to, and I had trouble falling asleep or staying asleep because of pictures of thoughts about it that came into my mind.
City and community leaders hope that this information will help identify health trends and risks associated with Harvey. It will also support future planning for natural disasters and policy-making decisions.
On average, it took about 7 weeks for piles of trash to be cleared after Hurricane Harvey, and that is just one of the many findings in the first report from the Hurricane Harvey Registry. As of January, the registry has now captured the experience of more than 29,000 residents. 44% say they had their homes flooded. 55% had their homes damaged. On average, people who had to leave their homes were displaced about 20 weeks, and the majority say they have thought about Harvey when they didn't even mean to, or had trouble falling or staying asleep.
These findings reinforce my long-standing concern that even though our city has bounced back from Harvey, we still have more healing to do. And I pledge to make the resources of the city's health department and other branches of city government available to act on the findings when the survey is complete.
By the way, this is the first in-depth look that we are getting at the impacts of Hurricane Harvey on people here in our region. The registry is a joint venture between Rice University, the Environmental Defense Fund, and the Houston Health Department, along with health departments from other counties here in our region.
The biggest impact Harvey is on Houston's mental health.
That's according to the first findings from the city's Hurricane Harvey Registry survey. Community leaders came together yesterday to announce what they have learned so far. According to Houston's Mayor Sylvester Turner, most of the city still gets very anxious when it rains. They also know the whole city was impacted, whether or not their homes were flooded. So far, the group has surveyed well over 13,000 people, but over 40,000 people were affected by Harvey. Leaders are hoping to increase enrollment in order to track Harvey's true impact. The survey is molded after the one that was created for New Yorkers after 9/11.
On average, it took about 7 weeks for piles of trash to be cleared after Hurricane Harvey. That is just one of the many findings in the first report from the Hurricane Harvey Registry. Now, as of January, that registry has captured the experience of more than 29,000 Houstonians. 44% say their homes were flooded. 55% had their homes damaged in some way. And on average, people who had to leave their homes were displaced for 20 weeks. Now, the majority of the people in this survey say they thought about Harvey even when they didn't intend to, or they had trouble falling or staying asleep.
These findings reinforce my long-standing concern that even though our city has bounced back from Harvey, we still have more healing to do. And I pledge to make the resources of the city's health department and other branches of city government available to act on the findings when the survey is complete.
Now, this is kind of the first in-depth snapshot that we're getting at the impacts, the long-term impacts of Harvey on people here. That registry is a joint venture between Rice University, the Environmental Defense Fund, and the Houston Health Department, along with health departments from other counties in the region as well.